Today, let us discuss 5 most common questions that are asked by patients who are looking for hair transplant. Doctor, is a hair transplant a permanent solution for my hair loss? The answer is yes. So, hair transplant is a permanent solution for your hair loss because the grafts or your hair, along with the roots, they are extracted from areas where they are going to be always present. And those grafts or roots are resistant to the process of balding, and hence they are placed in an area which is going to be there forever. So in short, yes, the results of hair transplant are permanent. Then coming to the second question, that is it a painful procedure? That is what they ask. So yes, it is a uncomfortable procedure, you can say, but it is not exactly painful, because to cope up with the pain they are going to give you anesthesia, they are going to give you sedatives to make you feel comfortable. So discomfort is there definitely, but no, it's not a very painful procedure. Coming to the third question, when can I return to my work, or what is the recovery period, how much time should I plan for my hair transplant, such things, right? So that depends on what is the level of work you are doing, whether it's an indoor work or it's an outdoor work, what is the amount of physical strain you are going to put in your work. Say suppose if you just have a desk job or you are just a software engineer working from home, you can return to your work from the next day itself. Or if you are somebody who requires to go outdoors, who happen to be exposed to dust, sunlight, such things, then it is always better to stay in the home for 7 days and give it a little rest for your body to recover, for your grafts to recover and develop a good circulation. In short, you have to be in home. There are certain sprays and certain medications given to you that will be dealing with your pain. There are certain antibiotics given to you that will work on you. That is irrespective of the surgery, you have to take it, whether you're feeling pain or not feeling pain. So these are medications that you have to take, as well as certain solutions and everything doctor is going to give to you to spray. And most important is that the grafts are in a sensitive position. So in case you move about, if somebody is touching you or if your scalp is bumping into something, then we don't want the grafts to dislodge from there in the initial phase. After a week they would settle in inside and no aftercare is required post 7 days. But 7 days is something you have to consider as a recovery period according to the level of work that you do. Fourth question most commonly asked is what will be the cost involved with the hair transplant. So cost is something which is very variable and depends on who is doing the procedure, depending on your city, depending on the expertise of your doctor. But having said that, it is always better to get it done from a qualified dermatologist or a qualified plastic surgeon, because there are scenarios in which things go wrong, and that is a time that your doctor can take a call and they know what to do in case the things go wrong. So it's very important for you to feel in safe hands. In the times that are coming, there are a lot of instances in which doctors are not doing procedures, doctors are absent from the operation theater where your hair transplantation is being performed, or it is being performed by technicians, and there is no safety protocol, there is no on-call anesthetist, or there are no equipments as such to revive you in case things go wrong. So it is always advised to not look at the cost point of view, but to see it at a safety point of view. So having said that, the cost of grafts. So graft is a bunch of your follicles, and it depends on how many grafts they are going to implant, how much area they are going to cover. So cost factor is entirely dependent on the number of grafts or follicles used. It can vary from 10 rupees per graft, it can go up till 40 to 50 rupees per graft depending on the expertise of the place and the doctor. The fifth most common question that people ask is, are there going to be any side effects of the surgery? This kind of things. So the transplantation procedure as such is now, if I am talking about FUE, there are no stitches involved, there is no involvement of depth component. Like whatever the procedure is going to be performed is on a very superficial level. There is going to be tumescent anesthesia, that means a lot of fluids are going to be injected just below the hair follicle in order to bring the follicle to a higher position where your doctors don't have to go too much in the depth of your scalp. So initially there is your scalp. In the scalp there are various 4-5 layers are there, and then there is a fat pad, and then there is a glia, which is a tissue, and then is your scalp. So when some people say that is it going to affect my eye or is it going to affect my brain, so there is no chance of affection to the eye or brain or such things, because the hair transplantation FUE procedure is performed at a very superficial level. It is hardly 6 millimeters to 8 millimeters, something like that. The doctor is going and taking out the grafts and going there and implanting, and the work is done with very fine instruments. So it's more of a work of finesse rather than lot of aggressive surgical things involved with the procedure, and hence as of now we can say that yeah, it doesn't have any side effects. At any age you can get the transplant done.